Hello everyone, I'm Antonio Moreno and I'm going to talk about bronchitis. Why have I chosen this disease? I have chosen bronchitis because my grandfather suffered from this disease frequently and I wanted to investigate more about it. Definition: bronchitis is an acute of chronic inflammation of the mucosa of the bronchi, the airways that carry oxygen to your lungs. This causes a cough that often has mucus. It also causes shortness of breath, wheezing, and chest thickness. Causes: the same virus that cause colds and flu are the most frequently cause of acute bronchitis. Sometimes the disease is caused by bacteria. Certain substances can irritate the lungs and respiratory tract and increase the risk of acute bronchitis. At first, it affects the nose and throat and then spreads to the lungs. History: the definition of emphysema is very similar to the one we still use. It's due to René Laennec and was introduced into medical practice at the beginning of the 19th century. Charles Badman, who was an English physician, used the term bronchitis for the first time during the same century. In 1789, Antoine Lavoisier also used it. Epidemiology: bronchitis can have several origins, usually viral. Therefore, this respiratory infection is contagious. For example, a key could infect it, but an asthmatic bronchitis couldn't. The most effective method to minimize the risk of infection is to avoid droplets of mucus when coughing and sneezing. Symptoms: the symptoms are cough with mucus, inflammation of the bronchi, obstruction of the alveoli, beeps with breathing, fatigue, respiratory difficulty, hoarseness, and general malaise. Diagnosis: it can be difficult to distinguish the symptoms of bronchitis from those of a cold. During the examination, the doctor will use a stethoscope to listen carefully to the lung. In some cases, the following tests may be performed: chest X-ray, sputum examination, and pulmonary function test. Treatment: most cases of bronchitis get better without treatment, usually after a couple of weeks. Most cases of bronchitis are caused by viral infection, so antibiotics are not effective. In some cases, the doctor may recommend some medication for cough. Prevention: to prevent the risk of getting bronchitis, follow the following tips: avoid cigarette, smoke, get vaccinated, and wash your hands and wear a surgical mask. World Disease Day. The third Wednesday of November marks the World Day of Chronic Obstructive Pulmonary Disease (COPD), which include disease such as chronic bronchitis, emphysema, and chronic asthma. Personal opinion: I think it is not very serious disease if you know how to prevent it. However, it can become complicated and even deadly for the most vulnerable people, such as the elderly, young children, people with heart disease or lung disease, and smokers. Experiment: natural remedy against bronchitis. Eucalyptus can be a good natural remedy to try to calm bronchitis. Eucalyptus has expectorant, antibacterial, and decongestant effects. It is prepared in infusion and can be drunk and inhaled, favoring the expulsion of phlegm.